This event is organized by UNEP Global Mercury Partnership. Before we begin officially, let me walk you through a few housekeeping notes. First of all, the moderator will open the floor for questions and comments at the end of all presentations. If you wish to take the floor, please click the raised hand icon that appears next to your name on the participants panel. You may also find this icon at the bottom of your screen. The moderator will call on speakers in the order of raised hands and invite you to unmute yourself when it's your turn. After your intervention, kindly mute yourself again and click lower hand icon. You may also wish to type your questions or comments in the chat box and send them to everyone. If you experience any technical issues, please write in the chat box and send your message to the host or co-host for assistance. Finally, to help us improve future sessions, we invite you to complete the short feedback survey at the end of this webinar. And a note of a brief disclaimer: the views expressed by the speakers, moderators, and participants during this pre-COP6 online event are those of the individuals concerned and do not necessarily reflect the views or policies of the Secretariat. With that, it is now my pleasure to hand over to our moderator, Imelda, to begin the session. Thank you. Over to you, Imelda.
Thank you very much, Shariful, for this housekeeping. So I will not have to go through the housekeeping from my side. Thank you very much. And again, good morning, good afternoon, and good evening to all. Welcome to this side event, pre-COP6 side event on the management of mercury waste in the healthcare sector, from existing tools to inclusive applications. So my name is Imelda Dosu-Etui. I'm from the UNEP Chemicals and Health branch, from the Knowledge and Risk Unit, and we host the Secretariat of the UNEP Global Mercury Partnership. So without further ado, let me quickly go through the agenda for today. We will hear from four speakers. We will learn from Christabel about existing facilities for mercury waste management. Then we will learn from two countries currently implementing a project on phasing out mercury-containing measuring medical devices. So with Albania and Montenegro, we will hear more about their progress, challenges, and need for the sound management of mercury medical devices at national level. And then we will learn also from the experiences of Gilberto Borogan on the implementation of similar projects in other countries. So let me first welcome my colleague Grace Hala for her opening remarks. Thank you. Grace, over to you.
Thank you. Thank you, Imelda. Good morning, good afternoon, and good evening, colleagues, partners, and distinguished participants. Again, also a very warm welcome from me, and thank you for joining today's event on the sound management of waste from mercury-containing products. So I'm Grace Hala, and I'm from the UNEP GEF Chemicals and Waste Unit, and it's a pleasure for me to open this important session today. As many of you are aware, improper management of mercury waste poses significant risk to both human health and the environment. Despite ongoing global efforts to reduce mercury use, waste from existing products continue to accumulate, especially in the healthcare sector. So this event today aims to highlight practical tools, case studies, and collaborative approaches that support the environmentally sound management of these wastes. We'll hear about the global mapping of mercury waste facilities and how this work complements the Global Mercury Partnership Waste Management Area's catalog of technologies and services on mercury waste management, national experiences from Albania and Montenegro, and effective practices for the treatment and final disposal of mercury waste in healthcare settings from the Asian Institute of Technology. So our speakers bring a wide range of expertise from international coordination to hands-on national implementation, and I'm confident that their insights will inform and inspire continued progress under the Minamata Convention and beyond. And I also invite all of you to engage actively in today's discussions in the interactive session that will follow the presentations. Your experiences and questions and perspectives are critical to shape practical and effective solutions. And with that, I will hand the floor back to Imelda to introduce our first speaker. Thank you.
Thank you very much, Grace. So let's start with my colleague, Christabel Mibenge. Christabel has over 20 years of multidisciplinary experience spanning the public and private sectors. She has worked with the Ministry of Health in Zambia, leading pollution control and chemical safety. And she is currently serving as the mercury waste management expert within UNEP and supporting the Secretariat of the Global Mercury Partnership, where she provides technical oversight and support for the environmentally sound management of mercury waste in global and country level projects. So Christabel, over to you for your presentation. Thank you.
Thank you, Imelda, and good morning, good afternoon, everyone. I'll take you through quickly just to share what we have in terms of facilities that are currently treating and also able to provide disposal facilities for the mercury waste at the global level, as well as look at it at regional level. Next slide. So why is it important for us to have this? I think in all the efforts that the Minamata Convention is trying to put together to phase down and phase out these mercury containing devices or products, we need to know what happens to those that we phase out. Or when we phase down, what happens to those that are already in use or those that go absolute? So it's important for us, even as we put up projects, to understand where this waste will ultimately end up. So it's very important for us to look at that. It also helps us to know what capacity is there when you look on the global scale, what capacity is there by region in terms of treating. If we are doing a project, for instance, in Africa, is there capacity within Africa for them to treat this waste and finally dispose, or do we need to do some cross-border and bring in issues of the Basel Convention to ensure that the sound management of that waste? And it also brings out the gaps and also investment priorities. I think, as we'll see from the projects that we're currently working in, there's already this gap that we've identified where we are unable to treat within the countries where we are implementing. So already we have to look at another facility that will help us with the treatment as well as the disposal. And it also helps us to look at the safer transition as we move in the medical devices. For instance, how do you transit from those containing mercury to the alternatives that do not contain mercury? So this is very important, I think, for the projects that are being implemented. And I think you realize that most of the projects will actually end at the phase out. So you phase out these mercury containing devices or products. What happens after you've done that? Where do you store this? There are projects where these have been stored in their interim storage and pending disposal because this was not considered. So it's important as we consider this mapping exercise to look at what is available, what are they able to treat, where is it located, what capacities are there, and then as you start planning, putting together your project proposals, those are areas that you need to look at. Next slide. So when you look at these facilities and the regions that we have high capacity regions who have technically advanced in terms of treatment and disposal. We have those that are emerging with capacities. These are mostly from China and part of Asia, as well as some Latin America countries. So where the hazardous industry is now growing, and you can see them emerging with this capacity to have treatment and disposal facilities. And then limited capacities where most of the countries are, most of the small island development states, the African countries and part of Asia are under these, and these mostly rely on export to other countries for their disposal of the waste. And then when it comes to the healthcare sector, we've seen that it often lacks dedicated mercury waste streams that leads to the issues of exposure in the environment, as well as to the humans or the people who are working in those areas in terms of occupational health and safety. So when this waste is not properly segregated from source until it's finally disposed, we are having this waste and all the hazardous nature that it carries with it being exposed to the environment and ultimately leading to the effect in human beings. Next slide. So this gives some overview of regional distribution. It's not limited to this. I think some of the areas like Europe and Americas have more facilities, especially in Europe. But in our work, we've tried to identify, especially in the areas where we're working, the projects that I will quickly highlight on in terms of localities, so that this can give us that snapshots that we want to appreciate and understand what facilities are there and the type of treatment methods that apply. So for instance, in Europe, where we have Albania and Montenegro, we have some of these facilities. We have Metasis, which we are currently working on with Thailand to dispose the amalgam waste. And we also have Batrek, which is in Switzerland. So when you look at this mapping, it helps us to know, even as we try to understand and identify where we are going to treat our waste, we need to know where these are located and the type of waste that they are able to treat on, and the type of method. Is it a method that will help us achieve that sound environmental sound management of the mercury waste? And then all the way. And then when you come to Africa, for example, we have in South Africa where we have one where they do engineered landfill and stabilization. So across the continent, if we are to remove all the mercury medical devices and dispose them off, are we going to take them all the way to Europe, or within Africa, do we have facilities which can readily accept and treat this waste? So there are gaps that we've identified in this distribution. Next slide. That we need to consider and look at. So this just gives us in a map view the location of these facilities. So you're able to see that major facilities are found in North America, Europe, and some portions of Asia. And while in contrast, Africa and Latin America have very little infrastructure, especially those that are designed for mercury treatment, because most of the hazardous facilities that may be there, you'll find that they are able to treat and manage the other waste and not really mercury. So when it comes to mercury specific waste management, we have very little facilities that are able to do that. And then when it comes to our projects that we are working on, next slide. As I move to conclusion, so we have currently 2 projects that we are working on. We have the dental, the phase down of the dental amalgam projects in Uruguay, Senegal, and Thailand. And these, as you can see on the map, it shows where they are located. So when you interface this with the facility map, you're already able to see the gaps and the challenges that we will have when it comes to the management of the waste in these facilities. Look at where Senegal is. And when you interface with the map of facilities. There's no treatment facilities near here. So it means that whatever measures of treatment or disposal that we are going to put in place for Senegal has to deal with us exporting and taking this waste to another country or entity that is able to receive and treat this. And then now these safety issues, we need to put guidance in place. We need to follow the Basel Convention in terms of transboundary movement of this waste and so on. Next slide. So this project is looking at the elimination of the dental amalgam from the health facilities, and you can see Senegal has 2 health facilities where they are installing separators, and Thailand has 8, and these have to be managed in a way that is environmentally sound. So with the challenges that we have in the local treatment capacity, we need to find means and ways that will still ensure that this waste is safely managed. And then we move to the next project that is looking at the mercury medical devices. Next slide. So this is being implemented in Albania, Burkina Faso, India, Montenegro, and Uganda. We'll hear from Albania and Montenegro, so I won't say much. But again, just to show their location on the map and the same challenges that occur in terms of lack of capacity or facilities within the vicinity. Next slide. Okay. So under this project, we are phasing out mercury added thermometers and the SFIGs from the health facilities. So we are looking at alternative procurement. We need to raise awareness, and most importantly, we need to look at safe and environmental management, looking at the interim storage as well as the final disposal. So these, I think, the 2 countries will present. So after saying all this, I think as I come to the last 2 slides, what is the implication of this? Next slide, Imelda. What is the implication? So this means that the national collection schemes that are temporary, in terms of temporal storage standards and emerging response, is compromised. The cost burden for export of this waste, the scarcity of regional treatment options will delay some of the implementation of the Minamata obligations. It also increases the risk of environmental contamination, especially if standards are not followed as given or as outlined in terms of disposal. It affects how the healthcare mercury phase out program will be done. So we need to ensure that we have adequate facilities for our safe disposal. And then lastly, the recommendations as I end my presentation. You can move to the recommendations. I think some of these I was highlighting them as I was presenting. So what we are trying to look at and ensure that we have in place is to align national law standards with the Minamata to enable Basel compliance in terms of transboundary pathways. So we need to have national laws and guidelines that will ensure the sound management of waste relating to the Minamata Convention and what the Basel that says build interim storage hubs and draw out clinical level controls, advocacy for regional treatment facilities, so that at least within a region you can have some facilities that can actually have treatment and disposal facilities, establish finance mechanism, and also strengthen institutional coordination is very important for us to strengthen our mercury waste management. So I know we'll hear more as the countries present. For now, I'll end here. Thank you so much.
Thank you very much, Christabel, for this very interesting presentation, which helps actually have an overview of the existing facilities, but also in comparison to our projects to see where are the gaps and the capacities needed for this sound management of the mercury containing measuring medical devices and dental amalgam. So we have 2 questions for you in the chat. One from Ezaku Tota and the second one from our colleague Kishore. The first one is linked to the stabilization. Ezaku is asking, what do you mean by stabilization Is it converting mercury to stable mercury sulfide, or is it just an engineered landfill where leaching of hazardous substances are controlled? The second question from Kishore relates to the secure landfills in your presentation. So do you have information about what types of mercury waste are landfilled and what measures are put in place to classify them as secured? So I would maybe invite you to respond in writings in the chat, please. And then if we have a bit of time at the end of the presentations, of course, I will give you the floor to add on if you want to say more. Thank you very much, Christabel. I hope that works for you.
Yeah, thank you.
Thank you very much. So let's continue with Miss Lejana Pojasi. I hope I'm not butchering too much your name, Lejana.
It's
So
okay. It's okay.
Lejana, thank you, thank you. So Lejana has background in biology, and she is a senior consultant with 14 years of experience in the field of environmental management and policies, and extensive experience in the Ministry of Environment, where her work was also related to waste management issues. So also between 2012 and 2023, Lejana has been Albanian national focal point in several conventions concerning environment, and currently Lejana is involved in our project to phase out mercury medical devices in Albania. So Lejana, you have the floor. Thank you.
Thank you, Imelda. Good morning, good afternoon, and good evening, everyone, and welcome to my presentation. Today, I will be presenting my country experience and perspective for handling mercury waste at national level, highlighting where we have made progress, the key challenges we still face, and the urgent needs going forward to ensure a safer, healthier environment for both patients and healthcare workers. In the first slide and the second slide, I have put information about relevant Albanian legal framework and international conventions. Mercury was historically used in healthcare devices due to its accuracy and stability. However, it is now considered outdated and hazardous because even small amounts pose serious health and environmental risks. Because of these dangers, many countries, including ours, have taken steps to phase out its use and regulate its disposal. The current legal frameworks includes law number 27, approved on March 2016 on chemicals management. This law regulates hazardous chemicals, including mercury, mandating that activities such as production, marketing, storage, and disposal be performed by licensed entities. In implementation of this law, several DCMs have been adopted as DCM number 442, approved on June 2019. This decision prohibits the export of metallic mercury, mercury compounds, and mixtures, and sets criteria for their safe storage. It specifies that the import, storage, and the marketing of mercury waste must be conducted by licensed entities. DCM number 319, approved on May 2019, sets out the restrictions for the production, placing on the market, and use of a list of certain hazardous chemicals and articles. One of the chemicals included in the list of restrictions is mercury. DCM number 449, approved on July 2024, detailed some rules for the registration of chemicals by manufacturers and importers, and for reporting in the electronic chemicals register. We have also the law on integrated waste management, approved on September 2011, This law outlines the responsibilities for waste management, including hazardous waste like mercury, emphasizing environmental protection and public health. Under this law is the DCM number 418, approved on May 2020, on integrated waste management strategic policy document and national plan for the period 2020-2035. This policy aims to create a strategic framework for integrated waste management, aligning with EU directives. In the second slide, please. Next slide. I have put here all the international conventions ratified by Albania. Basel Convention, which is ratified by Albania on June 1999 and entry into force in the same year on September. This convention regulates the international movement and disposal of hazardous waste, including mercury waste, with the goal of protecting human health and the environment from the harmful effects of such waste. Minamata Convention on Mercury, ratified by Albania on May 2020 and entry into force in the same year on August. The Minamata Convention focused on reducing mercury emissions and phasing out mercury-containing products. By ratifying this convention, Albania has committed to eliminate the use of mercury in healthcare and other sectors and ensure safe storage and disposal. Rotterdam Convention, ratified on August 2010. This convention ensures that hazardous chemicals, including mercury and the related compounds, are not imported or exported without the full knowledge and consent of the receiving country. Stockholm Convention on POPs, ratified on October 2004. This convention targeting chemicals that persist in the environment and pose health risks. I have put also in this slide the DCM number 442, dated on June 2019, because it's very important. In the chapter 2.2.3 refers to the ban on production, import and export of mercury added products. And in Annex 2, Part A, lists banned products, including thermometers and sphygmomanometers. In this decision, it is put a deadline for prohibition of import and export of mercury added products on December 31, 2025. Next slide, please. In this slide, I have put some activities that are done during the first year of the implementation of the project, phasing out mercury measuring devices in healthcare. The inception meeting and the first meeting of the National Project Steering Committee were successfully held in September 2024, bringing together representatives from national institutions, the healthcare and environmental sectors. These meetings serve to introduce the project objectives, define the roles and responsibilities of each stakeholder, and ensure institutional commitment. A draft SEP, Stakeholders Engagement Plan, has been developed in close consultation with relevant stakeholders, aiming to ensure transparency and effective collaboration throughout the project life cycle. An internal order has been issued by the operator of healthcare services, formalizing the institution's commitment to the implementation of the project and the demonstration phase. Demonstration of active replacement of mercury devices. In December 2024, a demonstration plan was prepared for the active replacement of mercury-containing medical devices. Trainings and the methodology for the preparation of the plan were provided by WHO and UNEP. 2 pilot healthcare facilities were selected to serve as test sites for the implementation of the replacement process. Introductory visits and stakeholder meetings were conducted in the pilot institutions to present the demonstration process, understand local conditions, and engage healthcare staff in the upcoming activities. A 3-day training workshop was organized in this year on May from 21 to 23, focusing on the health and environmental risks of mercury exposure, best practices for the safe handling and disposal of mercury devices and waste, and the benefits and use of mercury-free alternatives. Next slide, please. Several key activities and deliverables have been successfully finalized as part of the project. A comprehensive assessment of the current situation regarding the use of mercury-containing medical devices and the management of mercury waste in Albania. The preparation of a national inventory covering mercury-containing devices in use, out of use, and in storage. Finalization of a CAP survey, knowledge, attitudes, and practices conducted with the participation of almost all healthcare professionals across the country. This survey provided valuable insights into existing awareness, practices, and perceptions regarding the use and risks of mercury devices. We have designed also an interim storage site for mercury waste at Dibra Regional Hospital that ensure that removed devices are stored in accordance with national and international safety standards. These actions represent a significant step forwards in Albania's effort to phase out mercury in healthcare system. Next slide, please. This slide presents the collected data in a table showing mercury-containing devices that are currently in use, in storage, out of use, along with their total quantities at the national level. This inventory provides a clear and detailed overview of the current situation regarding these devices and serves as a basis for planning their safe removal, storage, and replacement with mercury-free alternatives. Next slide, please. Challenges in hazardous waste management in healthcare facilities. Despite Albania's progress in aligning its legislation with the EU standards, significant challenges and gaps remain in the effective management of hazardous and mercury waste in healthcare facilities. These challenges include lack of training, guidance, and awareness. There is a gap in the level of knowledge and awareness among healthcare workers regarding the risks associated with mercury, as well as the proper handling and disposal procedures for mercury-containing device. There is also a lack of clear and standardized guidelines for managing such equipment and responding to mercury spills or accidents. This contributes to unsafe practices and increases the risk of exposure to both humans and the environment. The second is limited resources and infrastructure. Several healthcare institutions, especially in rural areas, lack the necessary infrastructure, such as specialized containers, interim storage, certified transport services, and secure storage spaces. The current capacity for mercury-specific treatment facilities is inadequate. Recycling or safe treatment options are missing, meaning mercury waste may end up in landfills or be mismanaged. Furthermore, the procurement of mercury-free alternatives is often limited by budget constraints and delaying the phase-out process. Another challenge is inconsistent enforcement and monitoring. While national regulations are in place, their enforcement and monitoring of compliance across all health institutions remain inconsistent. Strengthening monitoring mechanisms with regular audits and inspections is crucial to ensure compliance across all institutions. Transportation procedure. The safe transportation of mercury waste remains a concern. There is a lack of certified transporters and secure. This poses risk of spillage, exposure, or contamination during transit and may delay or prevent proper waste management efforts. The last challenges is substitution of mercury devices. While safer alternatives to mercury devices exist and are available in the market, their adoption across the entire healthcare system is still limited. Some institutions remain unfamiliar with non-mercury alternatives. There is also a resistance to change, especially in facilities with long-standing reliance on traditional mercury instruments. And successful substitution requires not only procurement, but also training, user acceptance, and integration into clinical protocols. Next slide, please.
Yes, Lejana, please, if you can wrap up.
Yeah.
The next
Just
minutes.
in 2 minutes. Yeah, in 2 minutes, because needs and recommendation and conclusion I have. In needs and recommendation, phasing out mercury-containing devices, one of the core objectives is the gradual elimination of medical devices containing mercury from use in healthcare facilities across the country. This process involves identifying and removing existing mercury devices, prohibiting procurement and importation of new mercury-based equipment, and introducing and scaling up the use of safe mercury-free alternatives. Capacity building and training regards to manage the mercury waste need to have the clear procedures and need to train healthcare professionals and technical staff in. The safe handling of mercury-containing waste, the proper use and maintenance of alternative mercury-free devices. Infrastructure development to support the safe management of mercury waste need the development and strengthening of essential infrastructure, including designated interim storage for mercury waste, improvement of internal waste collection systems within healthcare institutions. Public awareness initiatives, implement targeted campaigns to raise awareness about mercury risks and promote the adoption of mercury-free devices among healthcare professionals and the general public. Activities on public awareness include information campaigns on the dangers of mercury exposure, promoting the benefits of mercury-free alternatives, and education materials. Next slide, please. Conclusions. Even Albania has established a well-developed legal framework that aligns with EU directives and the Minamata Convention. The challenges remain in enforcement, infrastructure development, public awareness, and capacity building. While healthcare facilities, mercury-containing devices are still in use, healthcare institutions currently have the inventory on mercury devices and waste, but no standardized protocols exist for safe segregation, storage, or disposal. In conclusion, a coordinated approach involving policy, investment, training, and enforcement is essential to eliminate mercury risks from our healthcare system. Let's continue working together for safer hospitals, healthier communities, and a cleaner environment. Thank you. That's enough.
Yes. Thank you, Lejana. Thank you very much. So in the interest of time, I put in the chat that please feel free to continue asking your questions in the chat. I see some other comments from Terence Thompson and David Hunter. So I invite the speakers also to check the chat. And without further ado, we'll move to our colleague, Gordana Djukanovic. So Gordana has a background in chemical technology and with over 26 years of professional experience in the field of environment protection. And among those years, we also have 16 years of experience at the Environmental Protection Agency of Montenegro. So currently, Gordana is serving as the National project coordinator in Montenegro for the current project on phasing out mercury measuring devices in healthcare. So Gordana, please, you have the floor. Try to stick to the 8-10 minutes, please. Thank you.
Thank you very much. Good morning, good afternoon, good evening from my side to everyone. We, Montenegro and Albania, we are a neighbor country, and we have a very common situation when we are talking about this topic. I will present our progress, challenges, and future steps in phasing out mercury measuring devices from healthcare facilities in Montenegro. Please, next slide. And we already heard in previous presentation, just to mention the main objective of our project is to eliminate mercury containing measuring devices and to save the time. I will ask you to go to the next slide, please. So this slide highlights the main results and milestones our project has achieved so far. We identify key national institutions and stakeholders and formally nominated the members of the project steering committee, ensuring effective coordination and oversight. Then we had also first inception stakeholder meeting, which brought together representatives from health, environmental and waste management sectors to discuss rules, responsibilities and joint priorities. Then developed stakeholder engagement strategy with comprehensive review of all mercury-related laws and regulations, and prepare a detailed report on inventory of mercury-containing medical devices, which was conducted across healthcare facilities in Montenegro in direct communication with all healthcare facilities, and providing a solid evidence of base for planning next steps. Then also launched a pilot project to demonstrate the replacement of mercury-containing medical devices with safe digital alternatives, and developed the feasibility study. The feasibility study was initiated on sustainable management of mercury and other hazardous medical waste, covering the entire life cycle from collection to final disposal, using a holistic and environmental sound approach. Next slide, please. On this slide presents the planned activities for the upcoming project phase, covering the end of 25-26 and 26 year. So we will also, as in Albania, we will start, I hope, next week. We'll have knowledge, altitude and practice survey and behavioral research to better understand how healthcare professionals and institutions, also the general public, perceive mercury-related risks and what barriers exist to change. Then we will develop comprehensive communication strategy. At the end, with all these documents, we will start to develop national strategy for the phase out of mercury-containing thermometers and sphygmomanometers in healthcare facilities. Also, we will focus on capacity building and our pilot activities. We have 4 selected healthcare institutions where the mercury-containing measuring devices will be replaced by mid of 2026, and this pilot will also serve as a training and demonstration sites for replication across the Montenegro. Next slide. These results are from our report that we about the inventory. We conducted the national inventory, as I mentioned, during December 24 and January 25, and the survey covered 37. We are a small country. We are not. We are not the smallest country in this project. So we covered 37 healthcare facilities, 30 public, 7 private, and found 100. In total, 100 mercury sphygmomanometers in 19 facilities and 93 mercury thermometers, mostly used in laboratory. We found 24 thermometers in our healthcare facilities. Although no mercury devices have been purchased in the last decade, many remain in use. Many, for us, is many. And then we identified 3 times more devices than in 2021. That was the year when we started to prepare this project. Please, next slide. So this is also from this study that I mentioned about the inventory, and you can see which situation we found in the facilities. And discarded mercury devices are often stored on site without proper segregation or documentation. Training on mercury hazardous and waste management is rare or absent, and spill incidents are rarely recorded. Please, next slide. So challenges also identified through this document you can see on this slide. Low awareness, centralized storage disposal facility. We don't have inadequate documentation, low awareness, the absence of formal procedures, and limited technical and financial resources. Please, next slide. So also recommendation. You can see from the photo from one of our trainings, recommendation which provide this inventory study, which are very common from the recommendation that we already heard from my colleague from Albania. So we can go at the Am I going too fast? Because we have very similar situation, and I want to give the time also to the other to exchange our experience. Am I going too fast?
Hey, no, please continue. And in case we have time at the end, of course, we'll collect questions.
Thank you very much.
Yes.
Because I don't want to read everything. It's visible to our participants, so we can go to another slide.
Yes.
Also from the same study for the same inventory, because we are very proud on those documents that we have already developed. So you can see what we have to do to moving forward, continue with our activities, establish safe waste storage, and build capacity, support, and promote. Next slide, please. I just want to mention one very important document for our country. It is the action plan for the implementation of the Minamata Convention for the next 2 years. And within this document, our government adopted the activities that we already planned in our project. So we already adopted some. We are already very familiar with the governmental activities. Next slide, please. So I already mentioned this feasibility study that we developed through this project. This is a very important document, and now it is in the final stage of the adoption from the governmental institution. So it provides a detailed assessment of the current situation in identifying existing gaps, needs, and institutional responsibilities in healthcare and waste management sectors. The study also includes a comprehensive analysis of international best practice, which is very important for us, highlighting successful models from the other countries that can be adopted to the Montenegrin context. Based on those findings, feasibility study outlines a set of recommendations. And these images that you can see show the example from the primary healthcare institution in the city of the Bar, illustrating how medical waste is collected, segregated, and temporarily stored under the controlled condition. Next slide, please. This is the location of the potential temporary storage of medical waste containing mercury in the same facility in the city of Bar, and we will now prepare. It will be the part of this warehouse. We plan to be reconstructed in accordance with WHO standards and recommendation for temporary storage of measuring devices containing mercury, which we will collect through this project. Next slide, please. I just put it in the next slide from this study, just assessment of cost for the temporary mercury containing waste storage in this facility. This is the money that we plan in our budget for this and next year through the pilot project, and I hope that we will successfully finalize this work at the beginning of the next year. Next slide, please. Of course, key challenges from the study, as you can see, a significant number of outdated and improperly stored mercury devices, low awareness, an urgent need to complete replacement with digital alternatives, and effective management demands clear guidance, logistical support, and coordination among institutions like Ministry of Health, Ministry of Ecology, Environmental Protection Agency, and etc. Next slide. At national level, So Montenegro, now this is most important part of my presentation because I want to share this with you that at our national level we don't have hazardous waste landfill. So long-term storage is impossible in Montenegro. This is connected with our further steps about regarding our project. So national strategy is also on hazardous waste management is urgently needed. So exporting hazardous waste for safe treatment abroad requires, as you know, significant financial resources, and the most important, all collected mercury devices must therefore be exported to authorized facilities abroad in compliance with international regulation. So if we did not finalize this, we will not consider that our project is finished. So, final slide, conclusions. So this GEF project, has made significant progress in identifying and addressing mercury use in healthcare. However, continued commitment, investment, and intersectoral cooperation are essential to achieve a fully mercury-free healthcare system. And together we can ensure safe, sustainable, and environmentally sound healthcare for all citizens of Montenegro. And thank you very much for your attention. That's the next slide. Imelda, you are muted.
Yes, thank you very much. I was saying, and I would invite you also to check the chat in case there are any comments or questions on your presentation. I will directly go to our last speaker, last but not least, of course. Maybe we'll learn actually and get responses to some of your challenges and recommendations. So we have Gilberto Borogan, who is the director of the Regional Resource Center for Asia and the Pacific at the Asian Institute of Technology, AIT, in Thailand, and an affiliated faculty in Urban Innovation and Sustainability at AIT. So I will directly give the floor to Gilberto Borogan to take us through his presentation. Gilberto, the floor is yours. Thank you.
Thank you very much, Imelda, and good day to everyone. I'd like to thank the Minamata Convention Secretariat and UNEP for this opportunity for me to share our experiences on the environmentally sound management of mercury-containing medical measuring devices in Indonesia and Philippines that we just implemented and completed. This is just a reflection. This is our collective effort toward achieving mercury-free healthcare system, especially in the ASEAN, in alignment with the Minamata Convention. So next slide, please. Next slide. Yes, thank you. So this project was supported by the Japan ASEAN Integration Fund, or in short, JAIF. This was implemented between November 2019 and September 2021 period. It was actually led by a proponent, Environmental Management Bureau, the Department of Environment, Natural Resources in the Philippines, with co-proponent, the Ministry of Environment and Forestry. Then now it's a Ministry of Environment in Indonesia, as EIT as the implementing agency. So as you notice here in this framework, we have the steering committee, which included the ASEAN Secretariat, of course, the Environment Division. We have the Japan Mission to ASEAN, and of course, Ministry of Environment Japan. With this project, despite the COVID-19 disruption, there's actually a good undertaking on this with the multinational team that coordinated well, both environment and the health ministries or departments in ASEAN, chemicals and working group and waste management. So the project actually, or team, brought together experts from us, from EIT. We have also international national consultant engaged and focal points to where we can coordinate at in ASEAN and the country level implementation. Next slide, please. Thank you. So this project main goal was actually to prevent the mercury adverse effects on human health and the environment through sound management of used thermometers and sphygmomanometers. So we pursued three objectives under this project. First, we assess the current practices in Indonesia and the Philippines. Second, we identify the gaps and strengthen guidelines for a safe collection, storage, and disposal. And thirdly, to promote awareness and encourage replication in the ASEAN. So together, this effort supported the capacity building, policy enhancement, as well as the transition to a mercury-free healthcare in the ASEAN. Next slide, please. So to simplify the logical flow under this exercise, we began with the situation analysis and data collection. Sorry, sorry, I was actually in the conference. And, excuse me. Focusing on how mercury devices were being used and stored and also disposed. Next, under this main activity, we have stakeholder consultations with line ministries like environment and health and agencies to review the legal frameworks and identify the gaps. This informed the technical, of course, guidelines and national inventories that followed. There were two national consultation workshops that was held per country in the Philippines and in Indonesia, alongside with the ASEAN dissemination workshop that helped us disseminate the findings and build capacity also to the ASEAN member states. So all these steps actually contributed directly to the ASEAN broader mercury reduction commitments, as well as an alignment with the Minamata and Basel conventions, among others, the strategies at national level. So just to get you a snapshot image or framework and the approach of the undertaking that was completed earlier. So basically, these are the processes or approach that I mentioned earlier, the main activities, which was we carried out, achieved the project in this three outcomes. Next slide, please. Next slide. So this is the framework or approach. So I will just focus on Indonesia. Next slide, please. So for Indonesia, our work started with a kick-off meeting in Jakarta that was held November 2019, and this was followed by the inception workshop in March 2020. Actually, these events hosted by the Ministry of Health and Ministry of Environment and Forestry to set the direction for the project. And we then conducted several activities like field visit to healthcare facilities, hospitals, and Pokismas to observe or having ocular inspection, the really real world practices in managing and handling mercury-containing measuring devices. In alignment with this, because Indonesia's this was supported by the Presidential Regulation number 21 of 2019 in Indonesia that has prioritized to the complete phase out of mercury containing medical measuring devices. And so this engagement helped us understand the progress made and challenges also still ahead. Next slide, please. So then came the pandemic. Almost overnight, our operation had to shift online. But with the strong support from the Ministry of Environment, Forestry, the health ministries, and DNR, also BCRC, SEA, the project continued without a pause. So we adopted a hybrid approach using remote coordination and digital data collection. So multiple online check-ins, review meetings keep us the project on track. And this adaptation didn't just sustain the progress, they demonstrated how collaboration and flexibility can keep environmental initiatives or projects moving toward even those this disruption. Next slide. So our wide survey. This is the findings in Indonesia. We targeted about 23,000 healthcare facilities and received 5,247 valid responses. So the respondents then included hospitals, laboratories, clinics, and public health operations, which the public health comprise about 70% responses. So this really an extensive participation provided with accurate image of the existing practices at healthcare facilities. And then we had then to sort out and develop the situation assessment reports where we analyzed the policy gaps, the storage methods, and disposal practices in these healthcare facilities, which help us form evidence base for improving mercury waste management across all 34 provinces of Indonesia. Next slide, please.
If you can start wrapping up, please.
Yes, sorry. So
Thank you.
just next slide, please. So that's next slide. Next slide. So our data also showed a considerable number of broken devices, especially sphygmomanometers concentrated in major provinces like East Java and Central Java. So we introduced then this hierarchy in facilitating, the elimination exercise for the especially sphygmomanometers. So this guidance framework were being utilized by the country and some healthcare facilities. Next slide, please. Next slide. Yes. So before closing, a few key challenges still remain. There's still low awareness of national policies, limited understanding of mercury-free substitute, even uneven interpretation of national strategies at local level. So many facilities also lack proper storage as well as waste transport systems. So we recommend for Indonesia strengthening awareness campaigns, improving data collection and verification, ensuring actually a better access to licensed treatments, storage, and disposal facilities. So we address these gaps as well as replicating it across ASEAN member states that can sustain the momentum toward a safe mercury healthcare facility. So thank you. I'll be happy to discuss further during the question and answer. Thank you.
Very much, Gilberto, and really sorry that we have to end at this time. We are already at the top of the hour, but I will encourage maybe the audience to reach out to the speakers. We have an event page on the Global Mercury Partnership website, and also I believe you will be accessing the slides through the Minamata Convention Secretariat, if I'm not mistaken. So without further ado, let me give the floor to my colleague Grace for some closing remarks. Thank you, Grace. You have the floor.
Yes, thank you, Imelda. Thank you for all of our speakers and participants for an engaging, informative session. I mean, it is very obvious that there are a lot of accessible tools and guidance and experiences that can support our effort in managing mercury waste in the medical care sector. And lastly, I think I want to take this opportunity to provide some information for, continue learning and exchange. So during the week of COP6, a knowledge lab has been organized actually on the final day of the COP, so on the 7th of November. And this session will be co-organized by the Global Mercury Partnership and the BRS Secretariat. And there will be an overview of existing tools and guidance and materials available for use by parties. So it will also include real world case studies from Uruguay and potentially India, demonstrating how these resources have been applied effectively on the ground. So I invite all interested stakeholders and parties to participate in this knowledge lab and contribute to the ongoing exchange and experiences and best practices. So I encourage you all to stay connected and explore the tools shared today and continue this dialogue in your regions and institutions. So thank you all, and we will see some of you during the week of COP6. Thank you very much.
Thank you very much, Grace. Thank you, everybody. And yes, see you at the COP. Thank you. Thank you, Shariful, as well. Thank you very much. Have a nice day, evening, or
Thanks
afternoon.
everyone.
Bye-bye.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye.
Thank you. Goodbye. Bye-bye.